Welcome back. This is Gateway 101. Remember, in Gateway 101, we places emphasis on prevention because we strongly believe that prevention is better than cure. And also, in Gateway 101, we encourage you and we also give you some healthcare tips, okay, that will help you and save you a lot of money. Okay, so we have a lot of home remedy videos that you can actually watch for free and implement whatever we have in that video to your own healthcare benefit. Okay, Gateway 101 places emphasis on prevention because I will also encourage our community to make sure they keep to their doctor appointment. We encourage them to go for regular checkup and we also encourage them to immunize, especially the children. Make sure immunization is up to date. This is Gateway 101. Okay, so we encourage you and we also provide free transport services free to any person living in our community that want to go for doctor appointment but they don't have the means of going. We do provide free doctor. We do provide free ride to your doctor appointment. Okay, that's all we do. This is Gate 101. So in today's broadcast, we're going to be talking about edema. Okay, edema. Edema is swelling caused by extra fluid trapped in the body tissue. So when there's extra fluid trapped in the body tissue, it causes edema. Okay, so basically, when fluid leak out of the tiny blood vessel and build up under the skin, you get puffiness, swelling. That's edema. Common place edema happen. What are the common place that you can identify that edema normally showed up? Please do not forget to subscribe. Do not forget to subscribe to Gateway 101. Okay, we're talking. Do not forget to subscribe, and the good Lord will bless you. Okay, okay. And Felafa, thank you for joining. Horse Lover Month. Thank you for joining. Felafa, we actually appreciate you joining this live broadcast. Okay, but people don't forget to subscribe. Okay, subscribe to Gateway 101, and the good Lord will bless you for doing that. We're talking about edema. I will say that edema is swelling caused by extra fluid trapped in the body tissue. Please subscribe and like, subscribe and like, subscribe and like. Very important. Okay, subscribe and like. Thank you, Edmond, for coming uh, Falefa. Thank you for joining. Okay, hi, welcome aboard. So subscribe and like, subscribe and like, subscribe and like the video. So we're talking about edema. I would say that edema is a swelling caused by extra fluid trapped in the body tissue. We also say that basically when fluid leak out of the tiny blood vessel and build up under the skin, you get puffiness, swelling. That's edema. Common place edema happen would be feet and ankle. That's the most common place where you have edema. Legs, hands and arm, face, especially around the eye. You have puffless. Abdominal fluid build up inside the belly. Okay. These are some common places that anyone can actually happen. So what it look feel like swollen or puffy skin. Skin may look stretched or shining. Pity edema. If you press the swelling area with one finger, it leaves a dent for a few seconds. So feeling of heaviness or tightness and sometimes discomfort or reduced movement. So please subscribe and like, subscribe, share and like, subscribe, share, like. This is Gateway 101. Please do not forget to subscribe to my YouTube channel. Subscribe and love, subscribe and like, subscribe and share. So we're talking about the common causes of edema. Edema can happen for any reason. Edema can happen for any reason, including made temporary causes. So standing or sitting too long can cause edema to happen in your feet or in your ankle. Eating too much salty food can also cause edema. Okay, pregnancy can also cause edema. Hot weather can also cause edema. Okay, the medical causes: heart failure, poor pumping lead to fluid buildup, kidney disease, fluid not removed properly, liver disease, low protein level cause swelling, venous insufficiency, weak leg, vein, blood, clot. Okay, certain medication like steroid or blood pressure drugs can actually cause, the side effect might be edema, can actually cause edema. When edema is serious, see a medical doctor immediately. Check quickly if swelling is sudden and painful in one leg. With shortness of breath or chest, pain. Okay, if you have a fluid, if you have edema build up in your chest, definitely you're going to have a shortness of breath. You're going to have a pain in your chest. So when somebody calling on chest pain, know that there's a fluid build up in the lungs and in the chest. So the person find it difficult to breathe. Okay, and why shortness of breath or chest pain? Severe, worsening or unexplained. Okay, associated with kidney, heart or liver problem. If your kidney, heart or liver had a problem, know that you will most likely get edema. If you want to, if you have edema in your chest, you're definitely going to have a chest pain because it is a worsening pain. Okay, so for those of you who are just joining us, we will recap very quick and we'll say that edema, pronounced edema, is swelling caused by extra fluid trapped in the body tissue. When fluid is trapped in the body tissue or the small blood vessels, if it's fluid is trapped, the place look puffy and swelling. So that's edema. Common place edema happen. Edema happen in your feet and ankle. That's the most common place where edema happen. Legs, hand, and arm, face, especially around the eyes. Is a common place edema can happen. Okay, so abdominal fluid buildup. Inside the belly, you have puff belly. This is as a result of edema. Okay, so what it look, feel like. So swelling or puffy skin. Skin may look stretched or shining. Pitting edema. If you press the swollen area with a finger, it leave a dent for a few seconds. So feeling of heaviness or tightness, sometimes discomfort or reduced movement. Cool. Common causes of edema. So edema can happen for many reasons. One temporary cause will be standing or sitting for too long, eating too much salty food, pregnancy, hot leg, so heart failure, poor pumping lead to build and flow, blood disease build for removal of property. Okay, kidney disease is a fluid not removed properly. Liver disease, high protein, low protein level cause swelling. Yeah. Okay. So medical causes we're talking about heart failure, poor pumping lead to fluid buildup in the lung and the stomach or the abdominal area. Kidney disease, fluid not removed properly, and liver disease will be low protein level causing swelling. Okay, venous insufficiency. Venous insufficiency, weak leg and vein, blood clot. Certain medication like steroid or blood pressure can cause edema to the feet. When edema is serious, see a medical urgent immediately. So get checked and quickly if swelling is sudden and painful in one leg with shortness of breath or chest pain. Severe worsening or unexplained associated with kidney, heart, or liver. Okay, so let's look at some causes of edema. Let's look at some causes of edema. So, number one, we said uh, edema in the feet, swelling caused by fluid buildup. Don't forget that when blood leaks from the tiny blood vessels, it causes pufflets and it causes fluid buildup. So edema in the feet, swelling caused by fluid buildup, can happen for a lot of reasons. Some harmless and temporary, other more serious. So the key is fighting out what's causing the fluid to collect in the lower leg and feet. Here are most common possible. Standing or sitting for too long. If you stand or sit for too long, if you notice your lower extremity might be swelling. Okay, long hour on your feet and sitting for long period like during travel can also cause back pain. Yeah, it can cause you edema. Okay, so sitting for too long period like during travel, you can give you edema. Gravity pull fluid can push food down into the feet. Okay, so usually improve with elevation. In injury or inflammation, swelling in one foot is often due to strain or fracture, bruising, tendon or ligament injury, insect bite or stings, often coupled with pain or redness. Poor blood circulation, venous insufficiency, when leg vein does not receive blood properly, it fluid leakage into tissue. Okay, when leg vein does not return properly not distributed. So fluid leak into the sign into the tissue. Signs are swelling, worsen at the end of the day. Yeah, because fluid swelling at the end of the day. So very short vein, skin discomfort around the ankle. Okay, so heart problem, heart failure. If the heart is not pumping effectively, fluid build up in the lungs. So yeah, so come swelling in both leg, shortness of breath, the okay, heart problem, heart failure. If the heart is not pumping effectively, fluid build up in the lungs, in the leg, swelling in both feet, shortness of breath, fatigue, and weight gain from previous laceration. Okay, the number. This need urgent medical attention. Kidney disease. Kidney help remove excess fluid if they are not working well. Fluid build up in the body. Swelling may occur in the feet or hand, often liquid changes in urination. Okay, liver disease. Liver problem can lower uh, albumin, a protein that keeps fluid from blood vessels. Leg swelling, abdominal swelling, okay, yelling of the eye, lymphedema, edema, fluid buildup with the nephro vessels damaged or blocked. Common causes will be persistent swelling, leg thickening, uh, okay, fluid blood clot, serious causes, usually in one leg. Warning signs: sudden swelling in one foot, leg, pain or tenderness. Okay, this is emergency because blood have traveled to the legs. Emergency. Swelling is common due to increased blood volume, decrease on the vein. Okay. However, sudden swelling with headache or high BP may signal preeclampsia. Medication. Some drug can cause retention, including calcium channel blockers, steroid, aspirin, ibuprofen, hemorrhoid medication. Certain diabetic drugs can also cause fluid retention. Excess of intake. Too much sodium make the body lose it at sodium. Okay. Swelling may worsen after certain meal. Obesity, extra weight increase pressure on vein and lymph vessels, leading to certain medication. So, infection, obesity, extra weight increases fatigue or okay. Thank you so much. So, obesity, extra weight increasing pressure on vein and nephro vessels, leading to swelling. Infection, food or skin infection can cause swelling, especially in diabetes patient. Sign with redness, warm to touch, fever, and pain. Okay, so when to seek medical help immediately. We said seek medical help immediately or ER if swelling goes and come. Go to urgent care or ER if swelling come and go. Sudden swelling in one leg, chest pain or shortness of breath, severe pain, redness, warmth, swelling with fever, swelling plus heart, kidney or liver symptom. Okay, just tell me, is the swelling in both one leg is is it painful at rest? How long has it been happening? Any heart killing blood pressure is among the questions you should be asking to try to ascertain if the person need some medical emergency. Okay, this is Gateway 101. For those of you who are just joining, please subscribe, like, share, subscribe, share, subscribe, share, subscribe, share, subscribe, share, subscribe, share. This is Gateway 101. Thank you all for watching. Bye for now. Okay, bye.